Still through to what's going on here at the Asaase Breakfast Show, and the moment this morning that gives me more joy than ever. It's nice to have something to celebrate, and no better celebration than the people who look after us when we're at our lowest. Yes, medical professionals, and specifically nurses, the people who are responsible for making us better when we're ill. Great news coming in yesterday of the big win by a woman who is a legend in her own right, deserves praise for what she's already done, but global recognition coming at the Aster Guardian's Global Nursing Awards 2025 for Naomi Oyoe Ohene Oti, an oncology nurse specialist at the Kolebu Teaching Hospital with nearly a quarter of a decade experience in the business, for what she has done for leadership, for training, and for setting standards of nursing care, specifically in the oncology field, over her career. Now, Naomi won from a pool of more than 100,000 people, and it's amazing. She has won the big prize of $250,000 and was declared the winner, the global winner, at a ceremony yesterday morning in Dubai, from where she joins us on the line. And we say good morning and big congratulations to you, Naomi.
Thank you very much. And good morning to all your listeners. Hello, Ghana.
You're still there in Dubai the morning after. Yesterday, our producer posted that link for the ceremony, and I was just holding my breath but thinking, what are the chances? The chances of you getting so far 100,000 nominations from over 199 countries worldwide, and you were in the list, the short list of 10 finalists. That would have been honor enough. Yesterday, you gathered at a very prestigious venue in Dubai to have the ceremony. What was racing through your mind in the build-up to the announcement of the winner?
Right. There was a whole lot of things going on in my mind, because everyone among the 10 finalists had beautiful stories, and they were all making remarkable impacts within their setting. So the feeling was any of us, but all of us were on the edge, really waiting for who to be called. And I don't know, just lo and behold, because we were all made to have our winners speech ready. Yes, winner's speech ready. So it's not whether it was only Naomi. All 10 were made to, and we were all treated same equally, given equal opportunity. So no one knew who was going to be called up on stage. You know, during the first part of the program, all of us were awarded, even including our grand jury, for the great work they did. So across board, so everyone could be called on that stage. So just as we're all waiting, and all of a sudden the announcement when Naomi, that was like, yes, I couldn't believe that. And it is quite humbling and very deeply emotional. I believe that you all saw what happened was, tears were just flowing, and it's quite really humbling. And this is a stage that is not just it's not a recognition of my victory. It's showing the very resilience, the dedication, and the potentials of nurses across Ghana, Africa, and beyond. Yes, the whole. Yes, and it's also showcasing the various, seniors, oncology nurses within Africa who are working themselves out, irrespective of their limited resources that they have, and doing marvelously well is also true.
Yes, in your acceptance speech, which you talked about having there in your hand, but thinking, it could be any one of us 10. You're up against somebody from Switzerland, somebody from Papua New Guinea, 2 people, a Filipino nurse based in the UAE, a Malaysian, 2 Indians, and so on and so forth. Only one other African in the short list of 10. But But you very generously in your speech gave honour, saying the recognition is not yours alone. It belongs to every nurse across Ghana, Africa and the world who leads with resilience, compassion and courage. And you talked about the inequities in cancer care that you have seen up close over your nearly 25 years in nursing. For you, what difference, it's not just about the money, although we asked you about the money when you came in here to the Asaase Breakfast Show, but what difference does the award and the recognition, what difference can it make to you and what you're trying to achieve with oncology care, first of all, here in Ghana?
Thank you. We could save money, but looking at the impact that money could make, first, it's more of the visibility of the recognition of nurses out there, the great work they are doing. That is what this award is about, making us being recognized as nurses who are making impact, irrespective of their limited resources. That is what this story is about. And I think we want to first make a shout out before I continue to Dr. Azad Nobin and the Aster team for this great establishment of this award to make nursing visible, because he made a statement that nurses are the soul or the heartbeat of a healthcare system. If they get it right, everything is right with the health system. He has a very big conglomerate of healthcare system, and he, over his looking at what he's built across, he's giving this tribute to nurses who have really made what he stands for and all that he's doing really impactful and stabilized. So
this is the Aster Healthcare Group, the leader of the Aster Healthcare Group.
So I think it is the same thing, we're dedicating it for the unseen nurses and what it is doing. And we also want to, not just for Ghana, harmonize our oncology nursing practice in Africa, because we want the whole of Africa to know that oncology nursing is a specialty and it's a very defined specialty within nursing, and it has to be regarded as that and remunerated accordingly. It's something that we really want to push that. If we were to do that, we will also do a lot of retention within our system, because you have equipped people, you have given them some form of dexterity to work at challenges, new challenges, and then you are remunerating them, and home is home. And you could cause some form of retention within the system. We're also looking forward to have a hub where we're going to train nurse leaders within the cancer space. Because nurses are known as advocates, they are advocating for them, for the patient's well-being. And most of the time, we usually will not see them at the table. We form more than 50% of the health workforce, but we are not seen at the table. And we are implementing. What are we implementing if we really don't understand what it is? So there's a need to break the gap from the bedside, then to the boardroom. We need to see nurses within the boardroom making impact, transforming life at the boardroom, and then that will be able to be translated to the bedside. So those are some of the things that we really want to do. We're also looking forward to also empower nurses another way, like to get some seed money to create a scholarship for nurses to be able to upgrade themselves, so that when leadership roles are created, we also see nurses up there making impacts in their world.
So in keeping with your own training that you did through distance learning with the Cancer Institute in the US, and how that trained you to be a trainer of trainers, you are still keeping your eye on that idea of how do you impart the skills, how do you pass on the skills, the knowledge to a new generation of nurses, as well as that important thing that you spoke about when you came into the studios a couple of weeks ago about the voice of nurses within the profession. Now, of course, we've seen people such as Dr. Dosia Kisei, in whose honour, who's the name, the award in whose name you actually won in the past, taking nursing to a very high level of specialisation. Dosia Kisei, Ghana's first person with a doctorate in nursing. Do you think that the problem of, if you like, the feebleness of the voice of nurses around the table when it comes to policy making about health is to do with simply your qualifications not being at the same level as the doctors, people expecting, oh, you have to talk to me on a doctorate level, or is it something just to do with pay scales, or the fact to do with nursing being largely a female profession?
Thank you for that question. It's yes and no, because we still have nurses who are also at that high level. It's the system making it, the powers that be, making sure that all are on the table. That is what we're talking about, because we have people, also nurses who are in academia and things. The other thing is the practice. We also need to have that high level nurses in practice, and that will be able to bridge a very good gap within. So those are some of the things that we're doing. Give remuneration to people who have acquired skills, not just skills, also have added value to themselves. Sometimes it's an issue within practice. Mm-hmm. So there's a need to recognize that once someone has added value to his or herself and is translating in whatever he is doing in terms of his or her output within the practice, it has to be acknowledged. And that is what Ghana College of Nurses and Midwives is standing for, where they are upgrading the knowledge of nurses in that specialty, and giving them room to also give inputs, go for research, doing studies, and then bring it to add on to translate into practice. So they are seen as people who are also versatile in academia, at the same time practice, and trying to bridge the gap between theory and practice right there. So if you have people who are in practice and also having those accolades in that high, manner, and also translating that, what they are getting at that high level, into practice, so that will also be good. So it means that those at the high level should make sure that all are included when policies are being driven. So that is what we are pushing for. And I think that is what Ghana College of Nurses and Midwives is also pushing for. So I always bridge the gap between academia and practice. And I believe that maybe in the next few, which I think it has started, bring some high-level meetings, or are trying as much as possible to bring those in practice at the same time academia together to be able to make sure that the policies are followed.
And through your work with the African Organization for Research and Training in Cancer, which you touched on it so briefly in your usual modest way, as if it's just a by thing, but it's a big thing. You spoke about it when you came in to do the original interview with us, about the work you're trying to do about standardizing care, standardizing practice in oncology nursing across African countries, sub-Saharan African countries in particular. And you've mentored nearly 50 nurses from across the African continent. For you, in your experience of engaging those young nurses and trying to impart your knowledge or share your knowledge and skills, what are some of the worst conditions that you have come across for oncology nurse practicing, or should I say some of the most challenging that you've come across the African continent?
I think it's more of resources in terms of not just human resources, one of the biggest challenges within people also having the interest into cancer care. That's also a challenge. Them getting the various the consumables to work with also is also a challenge. But the most important thing that the voice, hearing, crying out, making sure that, and I think this is coming up where WHO is leading, the African Union is making sure that governments also look out for non-communicable. Now, as the last 2 years, they tried to, there was a communique from a launch from WHO, which was done in Ghana, the non-communicable disease framework, lumping cancer, hypertension and diabetes, because almost all of their risk factors are similar. So they want to conquer them together. And they are pushing for all ministries of health within Africa to look at non-communicable disease and especially cancer, because it's coming up as one of the cause of deaths worldwide at the same time in Africa. In Africa, we are having over 1 million new cancers, and we are having over 70% of them dying, which is very bad for us, almost 64%, yes, almost. So it's something that is a need for, is like an SOS for every minister of health within Africa to look at training, not just training, availability of resources for those who are trained to be able to use it to provide cancer care for the populace. It's something that they should look at. Also, universal health coverage, which every African Ministry of Health has signed up for. They should look at that to include cancer care in it for people to have. Because we are aging, most of us are expectant age is going up. And so there is a possibility that we're going to see more of the cancers.
Sure.
Even as I think we are seeing, we're going to see more. And there has been the IF has postulated that we're going to really in the next, I'd say 5 years, just 5 years, we're going to see doubling of new cancers within Africa. So it's something that we really have to be poised and push forward for every ministry of health within Africa should look at that and make sure that there's a budget for it, and make sure that our people get universal health care if they get cancer. Right?
Now, anybody listening to you will be impressed with your grasp of the whole thing, Naomi, because you speak from the point of view of policy. You've got a continent-wide perspective on the business of nursing in general, oncology nursing in particular. So perhaps no surprise, even though I think the Aster Guardians Award is only in its 4th year, and you're not the first African winner. The very first winner of the award in 2022 was another African, but you come along and you bowl them over with your breadth of vision and also your grasp of the fundamentals, the hands-on stuff. That's clear to anybody listening to you. What do you think, though, was it that finally swung it in your favor with the jury?
I think that question was asked during media engagement, and I think the jury answered this with the media engagement. Most people would have thought it's the voting, but apparently that wasn't. It came up.
Oh, really? Because we all voted for you.
Yes. Not just only that, but I told you that I was also going to meet. That was one part, but there was another second level that I was going to meet a grand jury to pitch my work, and at the same time tell them what I was going to use the prize money for.
Sure.
So that was another level. So the voting was just a bit of it. Then the
real
second
viva.
Yeah. So they came up. What they said was they were looking out for not just what I was doing, the impact it was going to make, and then in looking at what I was going to do, not just the impact and the outcome all together. They were looking at that, and I pitched it well. And looking at what I have done and what I was going to do, they thought that was going to really get the visibility that they want, and the impact is going to make in the lives of not just nurses, the most important than our patients.
So again, it was that leadership and advocacy role that you've played for so many years, and the judges being able to see, yes, this individual can be the channel for so much that we want to project about the importance of the work of nurses. And indeed, as you said, Dr. Azad Mopane, the founder chairman of Aster DM Healthcare, in honouring you, said, Nurse Naomi Ohene Oti has redefined what it means to be a nurse, not just as a caregiver, but as an innovator, leader and change maker, and said your contributions uplift not only patients but an entire healthcare ecosystem, setting a gold standard for others to follow. Words to make your heart flutter, Naomi. Alicia Mopen, the managing director and group CEO of Aster DM Healthcare, also said your story is a powerful reminder of the quiet heroism that unfolds every day in hospitals, clinics and communities across the world. And talked about her pride in being able to shine a spotlight on the work that you do. For you, if you look in your mind's eye and you can see somebody out there starting out with her nursing training, perhaps not even thinking of a specialization yet, thinking to make a mark, slightly discouraged by all the stories we get about health professionals qualifying, not being placed within our public healthcare system at the moment. What would you say to that young person thinking, I care, I want to care, and I want to help make people better? How would you encourage him or her?
Thank you very much. To the younger person, I would say that do it as you're doing it for yourself. Put yourself, empathy. Put yourself in the patient's shoes and do it. Not expecting, you need to be motivated, all right, but it's also very important that everything you do, you document. It's very important. I also say that every nurse is a leader. Excuse me to say, even if it's just an injection, remember you are the leader in doing that, because the dexterity at which you're doing it, and you're expecting a particular outcome. How the standard in which you're doing it, following and making sure that it is done accordingly. You are a leader within that, so we should never see ourselves also as a layback. But remember that you're a leader, you should be an advocate for your patient, and that will also translate in whatever you're doing. But remember to always document whatever you're doing, because that is what the world will see. There's Aster guidance application that I did. I had to prove every part of what I said I was doing. So if I did not had any documentation, I would have done them in a way, but there was nothing to prove. So it's to a younger generation, it's very important, and they shouldn't take things for granted. Make sure that you document, because if it's not documented, it was not done. So it's very important that they document. And also remember that representation matters, evidence-based. That is what we practice. You should try as much as there are a lot of issues that are surrounding us as younger people, and we are the ones who are driving the data. We collect a lot of data, and it's very important that we translate this data into evidence, which will also then translate into the practice. We shouldn't just let it go away. We should be leads. We should not be the people who always like our voices are not supposed to be heard. No, we need to advocate for our patient. It's very, very important. We shouldn't say that once it's been written, it's been prescribed, and that person is the authority. Nursing is evolving. It has changed, because at the end of the day, if anything happens, both the prescriber, regardless of your state of the prescriber, and the one who translated that prescription into the patient are all liable. So it's very important that we advocate for our patient and also for their safety. At the end of the day, it also will translate into what we are doing.
So, Naomi, we're incredibly grateful to you for sharing this time with us, because we know you are super busy with media engagements today. You're already blazing across the Ghanaian media here, the story of your win yesterday. One last question. How much longer have you got in Dubai, and what are you going to do with your time there? Drink champagne, go shopping, plan your next coup? What are you going to do?
It's still engaging the media. Hopefully by the weekend I should be in.
As quickly as that?
Yes, as quickly as that.
This woman means business, and we're very grateful to you again for joining us on the Asaase Breakfast Show. The whole of Ghana's heart goes out to you, and we're so proud of what you have done to make us proud. God give you health, strength, courage, and fixity of purpose to continue doing the wonderful work that you have been doing for the past 23 years. Thank you so much, Naomi.
Thank you very much. But before going on, I still would like to appreciate the organizers, Dr. Azad Payne, the Aster team, DM Health team, our respected grand jury for all that they do for instituting this award. They've been very fantastic, and our stay has been so wonderful. I also want to thank the nursing and midwifery fraternity globally, all who matter, and those who also have been part of my education, our careers. I went to Achimota School, Accra, 92. Yes, Accra. Yes, Accra. University of Ghana alumni, KN University alumni. That's so University of Ghana was 99, KN University was 2010, 11, 12 there. Then Ghana College of Nurses and Midwives, one of the first 3 oncology specialists in the country, 2019 group. Say a shout out to you. Those are my academics. And I also want to thank, had a very massive support from my union, Ghana Registered Nurses Association, Midwife Association,
GRNMA,
the Ghana Diaspora Nurses Association, also from internationally, my International Society of Nurses and Cancer Care, AOTIC, the African Organization for Research and Training in Cancer, and the African Challenge, the from Kumasi and Africa, where about the SICAM team, the ASCO team, the Oncology Nursing Society's team. I also have to mention the American Cancer Society because I've worked with them. Then not forgetting the Church of Pentecost leadership, Apostle Eric Nyamike, chair, the executives, the entire Pentecost church from 195 countries.
They've been praying for you from 195 countries.
Yes. And then my apostle, Anthony Mensah, and the wife, and the whole Church of Pentecost, PIWC Atomic, my presiding, and the presbytery, the whole church. And everyone, the nursing and midwifery fraternity, and my regulator, nursing and midwifery council, and everyone, my husband who has been with me, supporting me, he's my major cheerleader, our children, and my parents, my in-laws, my siblings. I'm the first out of 5 boys. I'm the only girl. Cheers up to you.
You're still number 1, Naomi, and this is turning into a mega Oscar speech, and we understand why.
But my radiotherapy, oncology, and nuclear medicine center, the director, staff, my mentors. I don't want their lot. I don't want to mention their names. Colleagues. What the Breast Society of Ghana. I'm a member. Kudos to you. I don't know. And Vessels of Honor, I'm the leader for the choir, Vessels of Honor. PIWC Atomic, a shout out to you.
Naomi, I think when you're back everybody, I think when you're back at the weekend, what you're going to have to do is come back and do a series of interviews with us here on the Asaase Breakfast Show, where you can engage in conversation with all these people. We'll look forward to it. But Ayeko, thank you so much. Thank you for your work, and enjoy the rest of your time in Dubai. We look forward to seeing you back in Ghana. Thank you so much, and God bless you.
Thank you for having me. Thank you for having me. And thank you for your listeners. Thank you.
Naomi Ohene Oti there speaking from Dubai, and her win at the Aster the Aster Nursing Awards yesterday, and we are so proud of her.